Arthritis is a very potentially debilitating condition. It affects millions of Canadians, and there's actually a lot of different forms of arthritis. The most common form that most of us think of when we hear the word arthritis is osteoarthritis, and so that is typically the wear and tear that most people eventually, especially if they live long enough, will experience on the joints. And that can be arthritis of the shoulders, the knees, the hands, and that's just your general wear and tear. And what people who experience this type of arthritis, what they usually complain of is that sometimes they have a mild amount of stiffness, but as the day gets on and they start to use those joints, the inflammation starts to get worse and the pain starts to get worse. Another form of arthritis, though, that a lot of people don't typically talk about is inflammatory arthritis. And so you can consider this as a slightly more severe form of arthritis where, in addition to the inflammation, it's actually your immune system is kind of attacking your joints. Regardless if you have osteoarthritis or inflammatory arthritis, one of the main goals is managing pain. And so when it comes to pain management, you're stuck with anti-inflammatories, which are your Advils or your naproxens of the world, Tylenol, or opioid painkillers. And sometimes steroid injections work, but if you have multiple joints, it's hard to inject steroids all over the body. Nonetheless, cannabinoids have become extremely popular, and the Arthritis Society here in Canada, they mention that almost 1 in 2 of their members reports using cannabis for arthritis. It's typically osteoarthritis that patients are using cannabis for, but what we're seeing in the clinic is that this is a huge burden to society, and a huge number of referrals coming in come for arthritis. A lot of the patients will use high CBDs typically, and what they'll come back and report is that their joints feel a little bit more fluid, they're having a reduction in the inflammation, and they feel like their functioning has improved. Some patients will use a little bit more THC, but it's usually in the evening where the pain will affect their ability to sleep, so they'll use a little bit more THC and that will help them sleep. And sleep is really important to managing your mental health, and if you're in a chronic stress state, then your pain is also going to be worse the next day.
We were actually the first health charity to have a focused call on medical cannabis to understand what impact it has on arthritis patients. But coupled with that, if something is being used as a medicine, we think that it should be treated as such. So things like it needs to be taken in the context of a healthcare provider, making sure that it's monitored properly, but also people should have access to medical cannabis the same way they have access to their other medications. So right now, people actually can only obtain medical cannabis through mail order, as one example, which could be challenging. Unlike other medications, you would pay tax on medical cannabis, which is not something that we expect or is true for any other medication. So there are a number of things that we think that if something is being used properly as a medicine, it should be treated as such. And we also know that many people who are authorized to use medical cannabis are actually taking it for arthritis. So in that context, we've heard a lot from arthritis patients about what medical cannabis, the impact that it has on their disease. Most importantly, we want to make sure that at the Arthritis Society, we're trying to speak on behalf of patients and patient experiences. And for something that's been authorized for almost 20 years now, we hope that people can have access to medical cannabis in the way that they should. But really emphasizing that there is so much to learn, and we don't want to jump to conclusions, but we want to make sure that we're paying close attention to medical cannabis and giving it the attention and resources that we think it deserves.
Follow us on Twitter, Instagram, LinkedIn, and Facebook. Make sure you never miss a show by subscribing to our YouTube channel and clicking on the little notifications bell. If you're interested in getting monthly actionable investment ideas in the cannabis space to your inbox, subscribe to the newsletter at midasletter.com.